Welcome everyone to a brand new webinar with Cosmetic Laser Dermatology. Today we are here with the esteemed Dr. Kimberly Butterwick, and she is going to speak about skin tightening, what to do about skin laxity on the body. So she's going to go over skin tightening devices, lasers, biostimulatory fillers, topicals, and more, and ultimately how she and many of the providers at CL Derm are combining treatments to get the best possible results. So first, she will share the education with you guys, and then we will open up for Q&A. And just as a reminder, even though Dr. Butterwick is here today speaking about skin laxity and skin tightening, she does also do all sorts of injectables, laser treatments, body sculpting, Take 10, ThermiSculpt, all of the things. And same thing for our other providers. Most of them are also doing these skin tightening treatments as well. So without further ado, Dr. Butterwick, the floor is yours.
Okay, welcome everybody. Thank you for tuning in tonight. We're going to talk about the dreaded problem, skin laxity. These are some companies I have relationships with, but I'm not promoting any particular product or getting paid to do so. So skin laxity is kind of a growing problem. I'm seeing more and more people complain about it, my patients. The younger patients are looking down at their phones and they're getting this thing called tech neck, like looking at the laxity of the neck. And so that even has a special name called tech neck. And have you ever taken a picture of yourself on your phone when the phone's down on your lap? It looks like horrible. So we hate the looseness around our neck as we age. And many of the younger women will have loose skin after pregnancy. But also the baby boomers are coming in now. They've fixed up their face. Everything looks good from the neck up or face up at least. But then there's looseness all over the body with this crepey skin on the arms, the thighs, above the knees. Or when we hold your wine glass at a party, you can see that crepey twisting on the forearm. That's all. So, nobody likes that. And there are some nice things we can do about it. So today I'll kind of talk about what causes laxity, best treatments for laxity and crepiness, and some final tips. So what causes this? Well, photoaging is probably the number one problem, and that's really what we call sun damage. It damages the skin. Then we have genetic aging, where the underlying framework undergoes volume loss. As we age, our muscles get a little smaller. Our fat, unless we're gaining weight, will thin out a little bit. Even the bone will thin out. So the skin becomes like a dress that's too big. And so it's too big for the framework, and so it sags. That happens on the face as well. And once you hit menopause with loss of estrogen, this really accelerates the problem. A lot of women tell me my skin was doing okay until I hit menopause, and then it started getting loose and lax and not looking as good as it did. There's also more mechanical stretching that we're seeing now, not just with obesity gaining weight, but the rapid weight loss that we're seeing now in people on Ozempic and the other medications that are available now. If you lose weight slowly, that's the safe way to do it. The face will retain and the skin will retain more elasticity, but that rapid weight loss is particularly bad. And of course, after pregnancy, we usually do lose a lot of weight right at the beginning. So patients can feel like they've lost elasticity. Smoking and environmental factors also can cause this. You see on this hand depicted what I've just been talking about, the nice smooth skin of the 20s on the back of the hand. The skin gets looser, there's some volume loss. So by 80s, the skin is all crepey and there's no supporting framework underneath. And I just wanted to show you a little bit how this collagen and elastic fibers then, we're looking in that pink square. The top part, this little purple, is the epidermis, and then below that is the dermis. That's where the strength of our skin is. It has lots of pink collagen and lots of elastic fibers and lots of hyaluronic acid. Well, guess what? The sun and all these other factors can damage that dermis. See that big purple ball? That's like a damaged tumbleweed in our skin. It's called solar elastosis, and that makes us lose our elasticity. This is caused by years of sun exposure, not using good sunscreens that block UVA rays. So we see it depicted here in the skin under the microscope. So that, again, that solar elastosis, in this case, it's spreading out in the whole area. And look how wrinkled the skin can become and lose all the laxity. So this summer, what do you want to do? Like just wear your cover up all the time? Or do you want to fix up the skin and feel better about the skin? Now, not necessarily be a bathing suit, but many women tell me, I wish Jane Fonda was my patient, but she's not. But they tell me, oh, I never wear sleeveless clothes. I don't wear shorts. They're embarrassed about the skin. And this embarrassing problem can be addressed. So what are the best treatments for laxity and crepiness? Risa already alluded to it. We use devices. We do fillers or fat transfer and topical treatments. And best of all is the combination of all three. So we like to combine this to get to a sturdy, strong skin and dermis. And we need all three. We need all the help we can get. Now, first, let me talk about energy-based devices. In the top of the screen, there was a little picture of a hammer. And there's an old saying, if you only have a hammer as a tool, then everything looks like a nail. Well, at CL Derm, we don't have one hammer. We have a zillion hammers. We have over 50 different lasers and devices so that we can pick the right device for your problem. We use lasers for crepiness, radio frequency devices, and ultrasound, and I'll go into a little more detail. Now, what do these devices have in common? They all heat these little cells. No, those aren't mice or some lab animal. That is a picture blown up of fibroblasts. Those cells are in the dermis that I showed you in that pink square, and those cells produce collagen, elastic fibers, hyaluronic acid. We want those cells to be happy, and as they age a little bit, they slow down the production. But if we can get them to be active, you'll have more collagen, more elastic fibers, more hyaluronic acid, and a healthy skin. So the trick is to heat the fibroblasts. That sort of prods them into acting like they're 18 years old again. How hot do we have to get it with the devices? Well, pretty hot. We know, looking at the different devices, some temperature could be too hot, but we want the temperature of the dermis to be about 65 degrees. And at this level, see that little spiral? That's collagen. Let's just say that's a collagen fibers intertwined. When you heat it, part of it will melt a little bit and contract. And that's how we tighten things up, is getting a little bit of the collagen molecule to contract and heat like that. And so it'll shorten and you'll get tighter. So we also see that with the elastic fibers. So that's what heat does to the cells. That's why chemical peels can't really compete with what that can do. Now we do use lasers for tightening. On the face, you've heard of our Take 10. And yes, we all do these procedures, all physicians in our practice. The CO2 is fully ablative. It's very strong. It'll get you nice, tight envelope against the tissues below, like we see in this patient here, where it tightened up her jawline and her skin looks just years younger. But we cannot use a fully ablative CO2 on the body. It won't heal well. That skin does not have as many other structures to replace the skin. So we can't use a strong CO2 on the body. We can use a fractionated CO2 laser and some of these others. If we go too low, you won't see any result, but if we go too high, it'll scar. We must use lower settings than we normally would on the face. You'd think the face is more delicate? No, it's sturdy. We can laser that pretty strong, but starting the neck and the further down we go, we have to turn those lasers down. So this is a patient who had an IPL, that's an intense pulse light for the color changes on her neck, and then a fractionated CO2 laser. When the skin's really thin like this, and we're doing a laser anyway on the face, this is as strong as we can get on the neck. So you might say, oh, I still see a few more lines on her neck, but it's much better. It looks much more healthy. And if we went stronger, we'd be sorry. So fractionated lasers really help texture, color, help the skin look younger, but won't really get sagging as well. But look what happens if we go too strong. You can see white patches, you can see scarring, you can see the skin just looks a little weird. So don't ask for the strongest thing. That's really not what you want when it comes to resurfacing skin on the body. That's why we have other devices too, radio frequency devices. This is electrical energy, and we can tune the machine to go to different depths of the skin. We use microneedles, we have external hand pieces and internal hand pieces as well. Radio frequency can be a little confusing to you because there's so many different types. Monopolar goes a little deeper. Bipolar, the two electrodes are more superficial within the skin. And it depends on where we see the laxity, what tissue level we want to tighten. And sometimes we want to do both. So radio frequency lets us do that. There's many technologies. There's lots of hype with these technologies. Some before and afters that you see online are unbelievable, and frankly, they aren't believable. Now, this was a colleague of ours. He posted this picture. It shows that woman has lots of laxity, and he tightened it pretty well. Now, she may wish it was tight as a drum, but you can't get there really with one treatment. But the good thing about radio frequency, we can use it on all skin types. We can use it anywhere in the body. We use it arms, abdomen, neck, face as well, even the delicate eyelids. We can use this everywhere, and it will tighten your skin. If there's a whole lot of laxity, we can only get there part way. So Thermage is the radio frequency device that has tons of experience. We've had the device for over 20 years. And of course, it's better and better than it used to be. We put these little squares on and just go over and over to get tightening of the skin. This hurts. All radio frequency hurts. So in our office, we want you to be comfortable. We don't want you to be suffering. So we have nitrous. So you have a little tube and you can breathe in some nitrous if you'd like to ease the pain. You can have Tylenol and Advil. And if we're doing a stronger case, we'll give you some stronger medications, and then someone would drive you home. This is now very popular radio frequency microneedling, where needles are going into the skin. It's not just microneedling, it's radio frequency. And then the needles shoot energy down into the skin and heat it. And we can choose different levels. Today I saw someone, I did 3 different levels on her neck. And she was very pleased with what we were able to achieve. This patient has had 3 levels on her face, a deeper 2.2 millimeters, a 1.5, a 0.8, and then the skin will tighten with this, and there's no downtime, generally speaking. We can add exosomes and PRP to make it stronger. Or this patient had the radio frequency microneedling device we have is called Potenza. And so she's had 3 passes, and it will tighten that thin skin of the neck. I just saw her and she said, I am so much happier with my arms. I'm so much less embarrassed. You can see she goes out in the sun and she claims to wear lots of sunscreen. And some people just tan really easily and they enjoy being outside. So we'll have her use a good sunscreen, use a good cream, and we may even add other treatments to the Potenza. Our number 1 treatment, though, is using radio frequency under the skin. And one of our colleagues at Sculpting just did a whole webinar on this procedure, which again, we all do it in our practice, where the radiofrequency energy is actually under the skin. It's a little probe, we numb it up, we follow the temperature, and it's very quick. We can really get tightening on the neck. And this is something that will last a good 5 years. So if you're feeling like you're not ready for a facelift, but you want it to look better, there's no stitches. It's really a great procedure. I've been doing this for over 10 years. In fact, I was the first one to report to do the radio frequency, not alone, but after we melt the fat, go ahead and take the fat out. So this combination is highly, highly effective. Always just get the jowls, get the neck. So this one is great if you have sagging of the neck. It turns out it's sort of so-so on the rest of the body. Another patient, so all ages can be done. So I don't typically use that device on the arms, for example. So it's interesting, why do we have so many devices? Because some work better than others on different parts of the body. Microfocused ultrasound, Ulthera, has been around a long time. This is a whole different energy than radio frequency. It's ultrasound. And you can see the screen there. We can watch on the screen and see what depth we are trying to achieve to get the right tightness. So the beam comes out and we can watch it on the screen, those little white dots, and that it shows you where in the pink collagen where we're hitting to try to get more collagen in that deep plane. We don't want to hit the fat because we kind of like fat for the structure of the skin. So sometimes we'll even go under the fat to the fascia to tighten. And this can be used in many areas of the body, the neck, the chest, arms, front of the knee, whole front of the thigh, buttocks, inner thigh. So here it's a little patient had a little pocket under her neck. We were able to tighten that. And we did do the whole neck, and it tightens it some. And we can use it on the chest very commonly. So if the chest is well volumized, but it's kind of wrinkly and loose, then I like to use the ultrasound there. This is from a study that was done in our office where we get much improved texture, tone, and when you put your arms together, the skin won't all fold and be loose. This can be done above the knee. Another study that has been done where we get that skin above the knee to tighten so it's not embarrassing to see knee wrinkles. Another study showed on the inner arms, it's better to do 2 passes, 2 different planes than 1 plane. So we follow the literature, we perform studies to get the best results for you with the best machine. Softwave is a new type of ultrasound that we've had in our office now, probably a couple years. It goes 1.5 millimeters, so it has a uniform depth for the skin, for tightening the surface. It's used on the face and areas where the skin is thin. But a new use for it is on cellulite. It just got approved by the FDA for use in cellulite this year, where it will tighten some of that loose skin. Cellulite just isn't dimples, which we usually fix with another method, but it's looseness and waviness and cheesiness. So we can use soft wave treatments on that and to tighten the skin. So those are the devices that are typically used: radio frequency, ultrasound. There's no downtime. We get some good steady tightening, but we kind of wish it was better. Here's how I tell patients about it. I'll say, if these devices were students, they don't get an A, they don't get an A minus. They will get about a B minus C plus by themselves. It's pretty good. Oh, except for the ThermiType for the neck. I call that one an A. But most of them get you part of the way you want to be, but not all the way. And that's, as you see, why we were going to want to use other things, in particular fillers. So fillers for crepey, saggy skin, This is a whole new hot topic. I've given several webinars. I've demonstrated it at conferences, participated in panels, and everybody's very interested on fillers for crepey skin. And I'll just go ahead and talk about it. Turn your head if you don't want to see. You can, if there's just a few lines, you can take your hyaluronic acid. This is Bellatero, but we like a lightweight filler that won't show any sort of ridge. And we just kind of put it in there. The patients had numbing cream. It really doesn't hurt. And that will stay a good 8 months in the neck. So if there are only a few lines, we just fill them up with a low G prime, we call it, a kind of a lightweight hyaluronic acid. Bellatero, Redensity, Volite are some of the ones that are used there. And you can see here how her horizontal lines are much better. And she was very pleased that we could treat this and felt better about her neck. We also will enhance fillers in the neck like this with some Botox. We can use micro Botox. We dilute the Botox down and put lots of little tiny blebs. That's because there's a big muscle in the neck. And when it pulls, it makes the skin look just wrinkled. So if we want to smooth it, we can use the Botox trick as well. Then for more crepiness, though, we like Radius and Sculptra. These fillers are hot right now because they are not hyaluronic acid. And when you put them in, when you dilute them, first that turquoise blue pink, we first see about 2 months some type 3 collagen for wound healing. And then that turns into type 1 collagen, which is the collagen that gives us tissue strength and integrity. So we get a lot of collagen when we inject these, but you see the timeline is 6 months to even a year. And there's a little picture, I don't know if you can see that, where the collagen gets thicker, denser, and better when it's exposed to diluted Radius. We've been using Radius for jawline without diluting it, but now this new trick of diluting and hyperdiluting is relatively new, and it stimulates those 3 strands of collagen. It's actually not that new. I participated in a panel where we reviewed all the literature in 2018. We looked at everything. This was a worldwide panel to see what is the best treatment for all these different areas: neck, chest, arms, thighs, cellulite. And so for the hands, we usually will dilute that maybe 1 to 1. If you put Radius in straight in the hand, it gets lumpy, but we dilute it and we can get a very nice result there. For the arms, you're going to dilute it depending on how thick or thin the skin is. The thinner the skin, we dilute it more so it doesn't get bumpy. And 1 syringe, don't turn your head away if you want. The patient is numb at that little dot, and there's a needle for a guiding, and then that tube there is a cannula. It's not a needle, so this won't really bruise. And we just will take the cannula and disperse the product throughout the arm. Same thing, we can do this for the neck. We have to be very careful with the neck because the skin is so thin, but with 2 or 3 treatments, look at 4 months, 8 months, it will get better and better and better. In this recent panel, Dr. Alameda from Brazil, who's a wonderful expert, a wonderful colleague, she likes to dilute it 1 to 4. That's really the safest dilution, and put it in 5 columns to get a lovely response. I've done several inner thighs. This patient had a lot of scarring in her inner thighs from a bad lipo, and we were able to soften that with 3 sessions of calcium hydroxyl apatite, which is Radius. It's a calcium product. It takes a while, though. The skin will keep growing. This is what we've learned. We want to match the dilution to the skin thickness. We blend it a lot. And once we do the 3 sessions, once a year or so, we will do a maintenance of just 1. Same with the devices. The patient with the arms I showed you for Potenza, she was coming for a year touch-up. So we like to touch up with this once a year. Sculptra is the other one we use a lot. Um, and it is, again, a biostimulatory filler. It looks like a watery solution. It comes as a powder that we turn into a liquid. And again, we're going to get more collagen with this. And once we do a series, it's been demonstrated to last up to 30 months. We still don't want it to go down. So usually once a year, I'll do 1 vial. This is very commonly used in the face. This patient's had a lot of hyaluronic acid in the front of her face, and we use it for balancing in the perimeter. And you can see her face looks thinner, better, tighter, and the skin quality is nicer. So very commonly we use this in the face, but off the face, we dilute it way, way more. And we can use it in the chest, arms, knees, abdomen, buttocks, thighs. It's not so great for the hands or the neck, in my opinion. If there's an area with lots of movement, you might get some little nodules with it, which we don't want. But we've been using this in the chest in our practice for over 10 years, never had any sort of issue with it. It helps all those fine lines. And if we wanted, we could laser the skin lightly to get even more clear skin. This can be used on the abdomen for loose skin. This would be good for post-pregnancy to sort of glue the skin back on with some Sculptra. In the buttock, this is an area when you're trying to enlarge the bottom with Sculptra, you have to use 20 vials, 30 vials, a lot. But this patient on the right here, on the side where she had that loose skin in that hip dip, that does not take much Sculptra. So, or on the bottom, see how it's wrinkly at the bottom? That doesn't take too much. So if you just want to smooth out the skin, we can do less Sculptra. But if you want to make a big bottom, that's 20 vials. That's going to be expensive. But so is any treatment that enlarges the bottom. It's very safe. So with biostimulatory fillers, we've got Radiesse, which we like when skin thickness is the main factor, when we really want to get the integrity of the skin. And for Sculptra, I like it when for skin quality as well, and looseness when we want to glue things down a little bit more. There actually haven't been comparative studies, so a lot of what we've learned is from saying, you know what, I think I like Sculptra on the chest a little better. I think I like Radiesse, so trying both, and with trial and error and all the experience that have been pooled with all my colleagues, this is kind of how we've decided. I'm going to quickly go over fat transfer, which is one of my beloved techniques. I like doing fat transfer because these cells are amazing. They can turn into other cells. They secrete growth factors. They secrete factors that grow blood vessels. And we put in little, not big blobs of it, little, they call it a string of pearls, thin little wisps of the fat so that it will survive and live well in your skin. And this is someone 5 months out, so we're able to volumize, improve the skin quality. And I see patients who've had fat transfer, their pores are smaller. It really does help the quality of skin, and it lasts a long time. A study I did probably 20 years ago was this with centrifuge fat lasts longer. You can see the left hand with the ring has much more fat 3 years later than the non-centrifuge. So there's tricks to get fat to live longer. And our latest trick is to take the regular fat that we get and put it through a sieve. So I'll put thicker fat for volume and then a thin layer of this fat that's been through the sieve that has a lot of growth factors and factors that stimulate stem cells. So with this patient, these patients, this one had a wrist injury. She'd lost all the tissue around her wrist. You can see 6 months later how well that did, and same with the hand. So fat transfer is very good. It's a bit more of a procedure. This patient had, in person, you could see all this bumpiness and it looked like a shark bite really from a bad lipo job, and I was able to smooth that out, and it lasted a good year. course, just taking fat out can kind of tighten the skin if we do it right with small cannulas. And then we take that fat and we can put that into the body. And since it's summer, you may be interested in liposculpture as well. And we have a webinar I did last year, so you could watch that on our website. So to end up now, we like curated combinations for people. So we see devices get you so far, fillers, biostimulatory fillers take a while to see, but you start combining things together and some magic happens. So we can take, like this patient had 3 sessions with diluted radius on her really thin inner arm skin and 1 fractional laser. So that tightened the skin. It gave much better skin quality. I think we treated a few brown spots at the same time. And we got to the final result much faster. Same, arm like this had an Ulthera treatment with some Sculptra. This patient had a very bad thigh lift that left her legs scarred, and in person, it looked like cement and dense. And so we did a couple Ultheras to tighten the skin above of her legs and 5 sessions with Sculptra, and now her legs, the skin looked like normal legs, and she can wear shorts again because she has beautiful long legs. Or this patient had an IPL for color, Ulthera treatment, and 2 Sculptra vials. 3 years later, this is a patient that Dr. Fabi did. So we always want our patients to also use a very good lotion. 2 favorites in our practice, the Skin Medica Firm and Tone. I use that every day on my arms, put it on my neck. So don't let your skin get too lax or you'll have to do more treatment. Just start when it's, start using a cream to start with. The Elastin Transform is also an awesome one that will stimulate collagen. And actually you can see a result after about 60 days with these. And then you can put some retinol over the top. Remember to wear sunblock, wear protective clothing when you're outdoors playing sports and sweating off your sunscreen. So some final tips and takeaways. It does take a while to get where you want to be with skin laxity. Combinations are faster and give the best result. We have to individualize each treatment for the thickness of the skin, for the area, and so forth, and how much laxity. So once our goal is achieved, it's some work to get to the goal, but then maintenance is relatively easy once a year and using your creams. And there's some new treatments that can boost results, such as tightening the abdomen, the muscles, which I done, and that helps the whole area look tighter, the Cool Tone device. And then I also did this Tri-Lift device this is for the face that tightens your face nicely. So we do have other tricks up your sleeve. We don't have time to go over all of them today, but in summary, we want to treat the surface with lasers, get colors, and use topical good creams to keep the surface collagen growing. We'll need some deeper tightening now and then with ultrasound, radio frequency, or for the neck, that one that goes under the skin. And then we want to build integrity of the tissue, build more collagen with biostimulatory fillers, add some of your own fat, especially if we're doing some lipo, and help with some muscle tone. So that's it in a capsule. And I hope you understood that. We have some time for questions now.
Thank you so much, Dr. Butterwick. That was amazing. So helpful and so great to see. So we do already have some questions here, but this is a reminder, everyone that's here, this is the time to pop in any questions you would like Dr. Butterwick to answer. So here we go. This is an interesting one. I feel like I do a lot of lasers on the more lasers I do on my face, the thinner my skin gets. Is that the case?
No, people say that. They say my skin is too thin for a laser. And the truth is, on the face, lasers thicken the skin. I showed you that slide with the pink collagen and the epidermis on top. After a laser, the epidermis gets thicker and the reedy pegs that anchor it to the skin dive down deeper into the pink part, and the pink part gets thicker. So that is a misconception that lasers thin the skin. Lasers are good for thin skin. Now, we might be a little more gentle with thin skin, but if you want thicker skin, you need to laser it. I see a lot of older patients, and especially on the forearm, their skin starts bruising. It's so thin. There, we want to do a laser. We want to do some biostimulatory filler to thicken it. So don't be afraid, because a laser is exactly what you need for thin skin.
Got it. That is helpful. I have heard that as well. Okay, so how do I know if I could do one of these skin tightening treatments versus do I just need a facelift or neck
Ah,
lift?
well, we can help you with that decision. I think if you can take your skin and pull it out over your ears, you need a facelift. That's just too much. And there are some people that can do that. Frankly, since I did my tri lift, I can't pull my skin out. But
I'm very happy I
so
can't either.
if it's really loose, if you can pull your skin way out, it's facelift time. And I don't want to start you on a long process if it's really not going to help you. So we, in our practice, will evaluate you and be honest with you and say, you know what, it's time for a facelift. But sometimes it's like you don't need a facelift yet. I think one facelift is good. Two facelifts might start looking a little funny. Three is definitely probably too much. So you should kind of time your facelift and maybe do like the ThermiTight. That will get you 5 more years, especially if you have some fat. I did some threads and took the fat out of her jowl. And so she's really happy with the way her face looks now. She doesn't have time for a facelift. Plus, we're all afraid of looking a little funny. Now, facelifts are very popular and more people are doing them. And I'm not against facelifts, but it's not the answer to everything. It won't fix the quality of your skin, the thickness of your skin, the volume that you've lost. So it's all a rotation through different modalities. You can't rely on surgery for everything or you'll look pulled. You can't do fillers for everything or your face will look too big. And similarly, we can't just keep lasering and lasering. Because that won't be the answer to everything.
That is really helpful to hear. So how is something like this better than what are the benefits of doing this skin tightening treatments instead of a neck lift?
Oh, well, the benefits are there's no downtime. It's a lot less expensive. Facelifts are getting, if you've looked around, they're getting more and more expensive. So we can tighten the skin, and facelifts don't last forever. Usually I have patients who do go get facelifts, and within a couple years we're doing a little Botox, maybe a little light laser. So we always need, sadly, a little bit of maintenance, kind of like a house. You fix the roof, but then you need a little bit to fix the floor. And so it's always a little bit of something, but if you address it, overall, we look pretty good. So that's my theory is I like to rotate through different modalities, and through different tissues. Botox, when we can help muscles, or a muscle device when we can get tightening that way. Fillers to a certain degree, and the biostimulatory fillers will make your skin younger. And the other fillers can lift the face or take shadows out under the eyes or make your lips prettier. Then we go to tightening devices, the Ultheras, the radio frequencies. Morpheus is very popular, mainly because the Kardashians have promoted it. But there's many devices like our Potenza that are even newer than Morpheus, and they can help tighten the skin and tighten the jowls, tighten the arms, instead of surgery. I would never really recommend surgery for loose skin on the arms, because then you've got a big scar that never goes away. So your arm looks tighter in clothing, but you'd be embarrassed to raise your arm. So that's another reason this seminar is mostly on the body. That same with the knees. We don't do surgery. A big thigh lift is rarely done anymore. I've been in practice for 30 years, and I've probably seen patients, many, many patients, only about five thigh lifts through the years. They really don't work that well, and it's a lot of scarring. So it's nice to avoid big scars, especially in sunny California, where we like to, wear bathing suits and clothing that could show those scars.
That is really helpful to hear. So here's a follow-up to that. What are the best treatments for the wrinkly skin above the knees?
Yes, well, that will depend, and that's usually going to be a combination where probably ultrasound, we could use soft wave, if it's not too deeply loose, or Ulthera. And at the same time, we might use some Sculptra or the Radius. That's one area where I haven't decided which one I like better, Radius or Sculptra. We do need to do a comparison study, but they're very similar, those two. So we would do a couple sessions with that to get the skin tighter. So you don't have to be embarrassed about your knees, because we can work on that problem nicely.
Absolutely. All right. They said I came late, so I may have missed this, but what about loose skin on the stomach?
On the stomach, that's a problem for any woman who's had a baby. But we do a combination of things. One, sometimes people call loose skin, but it's really like a big roll of fat. So we could take fat out, and that tightens that roll and eliminates that. So sometimes we'll just do a little lipo there. But if it's really just the skin, then we will use two devices, usually thermage or ultrasound, the Ulthera, in combination with either Radius or Sculptra. There, because the skin is kind of droopy and we want to sort of glue it back on, I tend to use Sculptra. So we probably need about 3 sessions with Sculptra and a tightening. That is a lot of loose, kind of thick skin, and that will, kind of put you back in a bathing suit in a 2-piece instead of a 1-piece.
Love that. So how about these hyaluronic acid supplements for crepey skins or collagen supplements for crepey skins? Are those worth anything?
Well, I think we don't have data to prove that they work. There was a review a few years ago looking at every single article written about collagen supplements, and the answer was inconclusive. So we don't really know how much they help. You're not going to take a supplement and go, wow, look at my loose skin is gone. But it probably can help a little bit. One of my patients is in her 90s, and she loves to go on cruises, but all her friends are gone, so she'll go by herself, and she does Sculptra. So you're never too old to get a biostimulatory filler. Your cells will still work. But she told me she goes to Costco, and for decades she's been taking the collagen supplement there, and all of us would like to look like her when we're 90. Her skin is really quite nice. And it's terrible, but as we age, she said people don't want to talk to her if she looks too old. So we have in our society this sort of, it's a sad bias, and tend to ignore older patients. So please don't do that. But when you do make yourself look younger, you feel younger, and people respond to you better. So that's just our human nature, and we can do something about it. And if a little collagen pill is easy to take, I took 2 today. So I guess I believe in it. I don't know how much it helps.
Thank you for telling us the honest truth. So you mentioned TriLift. What is that?
Well, TriLift is a new thing. Last end of last summer, I saw a couple of my friends from another part of the country, dermatology girlfriends, and I was like, "You look really good. What'd you do?" And they both had this device, and what it is, it's a device that is mainly used on the face in this lower part, and it is radio frequency. So the radio frequency kind of goes round and round on your face. And at the same time, it tightens the muscle. So you feel your muscle quiver a little bit as you're getting it. So you're making the muscle stronger. So it pulls your face up, and you're using the radio frequency to tighten the skin and the connective tissue. Um, and and here's why I like it. One, it doesn't hurt too much. Many of our other devices hurt, and you have to be medicated or use your nitrous. With this one, we'll give you a couple of Tylenol. It feels a little zingy, it feels a little weird, but it's definitely tolerable, and it's only 8 minutes per side. It's a little intensive at first because um, as it warms up, you feel it feels a little zingy, but you get sort of used to it, kind of like a hot rocks massage. And so it's quick, and I don't need to take any medication, so I can do it fast and be done with it, which I like. But you do have to do 5 treatments to get where you want to be. So it's 5 treatments once a week. Then you can just do a booster probably about 3 times a year. Like I have an event coming up in June. I'll do it about 2 weeks before, and I'll look even more lifted. So it's easy. Layzanne Fletcher, our physician assistant, who's just awesome. She's been with us close to 15 years. She does it, so you don't have to wait for the doctor, and it's not so hard to schedule either. But she does a great job, and I would recommend that for the face.
Thank you so much for that explanation.
Yeah, in fact, it's the one treatment that I've gotten more compliments on, the one device than any of the others. I think because it shows faster. Ulthera, Thermage, radiofrequency microneedling, those take a few months to see. And because with this device, we get the muscle right away, it shows a little faster. Mhm.
All right. So, do threads in the face interfere when you put them on each side to pull up the cheeks? Is that going to interfere with any lasers or microneedling in the future?
Not in the future. I usually wait at least 3 months after I put them in to do anything directly over them. The threads that I like are the Silhouette InstaLift, and those will stay in the body close to a year. They're longer lasting than the PDO threads. So that's why I use them almost exclusively. Why do something that's only going to last 6 months? So we put, and I've had the threads too, probably had everything in practice over the years. So after we put them in, they'll anchor in and lift up a little bit more and more over a 6 month period. But right away you see them lift. So we don't want to interfere with them or heat them too much. You could put Sculptra or a biostimulatory filler near them, but I don't really want to take my needle and hit them. So frankly, I usually wait about 6 months before using filler near them, but I will heat and try to boost that collagen response. We know those cells, when those same fibroblast cells, that when they see the threads, they were like, huh, what is this? I think I'll make some collagen. So that's the trick, is getting those cells to make more collagen, and they'll encase the threads and lift up even more. So if we hit them with some heat, about 2-3 months later, we know that's actually going to boost the threads. So heat I will do 2 or 3 months later, but filler I'll wait just because I don't want to hit the threads with my needle or cannula.
That makes sense. Okay, we only have a few minutes left here. So many good questions. Let's see. Cost. So a couple people are asking about cost. I know that's a hard question to answer, but is there any guidance you can give on what, even a range?
Well, a range would be, it depends on obviously what we're going to use. Probably the least expensive thing to do is that lightweight filler in the necklines. That filler is, around $650 or up to $900. A vial of the other fillers, the Radius or the Sculptra, that will range anywhere from $900 to $1,300. And you have to do it 3 times. So it's going to be fairly expensive up front, and then it'll be easy for the next 10 years to maintain it and much less expensive. A device such as Thermage, Ulthera, radiofrequency microneedling could start at around 900 and go up to 4,000, depending on how many areas we do, how many passes are needed, how much time is needed. So we do invite you for a consultation, and we can see what you need, because as I said, everything has to be customized. We can't just rubber stamp and say, oh, this is a great treatment for everyone. We all have different skin in different areas with different problems. So, but you're gonna be probably in the thousands, but not over 5 to 10,000, depending on what you do. Unless you want that big bottom, that's going to cost you.
All right, I love it. So we do have a couple more questions. I think that the rest of these questions I will send over to Dr. Butterwick, and maybe we can try and answer them on our Instagram over the coming weeks. So make sure you guys are following us there. Otherwise, I do think that we have a question for you guys, those of you that stuck around here till the end, and then we have a little surprise for you all. So if it's okay, could I do the poll now, Dr. Butterwick?
Sure.
Okay, great. So you guys, these procedures that Dr. Butterwick was talking about today, they really are unique. There are really very few, if any, places in the country combining these technologies and devices and injectables. So we're trying to come up with a treatment name for it, something we can call this to explain it. So we came up with a couple options, and we are curious if you guys can help us pick the name. So right now, a little poll is going to pop up on your screen. And these are a couple names we've been considering. So any feedback, this is anonymous. So we're thinking, what about Tightify, Retight, C-Tight, kind of for customized, or BioTight, like biostimulators tight. So love some of your feedback right here. See what you guys think. So I'll just give you another couple moments to finish answering. Wow. Okay. Is anyone else? Oh my goodness. Dr. Butterwick's gonna be so happy when she sees these results.
Oh, good.
All right. So let's
It's probably the one you came up with.
no, it's
It
not.
isn't?
It's
Ah.
yours. All right. So here's the results of this poll. You guys actually liked BioTite the most.
Oh, great.
Look at that. That was kind of one of the newer ones we've been considering. So
It just went off like a light bulb today, about 10 minutes before the session.
exactly.
Well,
So
we'll keep you posted.
yes, we will keep you posted, and we're going to come up with something for this because it really is just so unique, and we want to help get it out there more. Okay, so that was the poll. Thank you so much for sharing. If anyone has any other thoughts or feedback, feel free to pop them into the chat now. Oh, Tightify. Oh, Tightify with a T instead of a GH. I like that, Dale. Um, all right. So anyways, we also have something else good for you guys that we didn't even promote. So for those of you that came and are here live, if any of you proceed with a skin tightening treatment and you get it booked before the end of June, you are going to get a complimentary, what is the product called?
Well, one of the two that we
Oh,
love,
yes.
the Medica Fermentone or the Elastin Transform.
Yes. So one of those two treatments or products, one of the ones that Dr. Butterwick says she uses every day, and I happen to use the other one. They're both great products. We sell both of them. So that is just a great little extra thank you for all of you for joining this webinar. So we have a list of everyone that joined this webinar. So when you call in and schedule your appointment, just make sure you say I attended the webinar and we'll have your list as well. And then if you book a skin tightening treatment with Dr. Butterwick or with any of our providers, we can go ahead and get you that complimentary full-size product.
Mhm.
So thank you so much, Dr. Butterwick. I really appreciate your
Thank
time
you,
after a
Lisa.
busy day of procedures. Thank you everyone who tuned in. I appreciate your time. I know it's a busy Tuesday for everyone out there. And otherwise, this is being recorded. I know a couple of you came in late. We will send it out to you all this weekend. And we please encourage you to follow us on social media to see where Dr. Butterwick can answer some more of the questions, and stay tuned to see what we come up with for the name for this treatment.
Mhm.
So thank you so much, Dr. Butterwick, and we hope to see you all in the practice soon.
Okay, great. Thank you,
Time to get
everyone.
tight.
Thanks for listening.
Okay, bye everyone.
Bye.